Hello, I'm Dr. Hiroshi Takeda. For over 30 years, I've been helping older adults in Japan recover from chronic nerve pain through traditional movement therapy. What you are about to see isn't a workout. It is a healing ritual that restores balance and relieves sciatica pain naturally. Did you know that in Japan, sciatica is rarely treated with painkillers? Instead, elderly people rely on a centuries-old stretching ritual called Shinkai Stretch, which literally means nerve reset. While Western medicine often focuses on injections or surgeries, Japanese rehabilitation centers emphasize one thing above all: movement, slow, deliberate, and consistent movement. When researchers from Kyoto University followed seniors practicing Shinkei-style stretches daily for 3 months, they found something remarkable. Patients reported 62% less pain, better balance, and improved sleep quality. It wasn't magic. It was simply the body remembering how to move again, gently, rhythmically, and with purpose. So what is the Shinkai stretch? It's a simple seated movement designed to release tension from the sciatic nerve, the long nerve that runs from your lower back, through your hips, and down each leg. When that nerve gets compressed, every step can feel like a sharp electric shock. But this stretch restores space where it's been lost. Think of it like giving your nerves room to breathe again. Sit on a firm chair with your feet flat on the ground. Straighten your spine. Imagine a thread gently pulling the top of your head upward. Now place your hands on your thighs and take a deep breath in. As you exhale, slowly lean forward, keeping your back straight until you feel a gentle pull behind your thighs. Pause, hold for 5 seconds, then return to upright. Repeat this 5 times, breathing slowly each time. That simple forward motion lengthens the muscles surrounding the sciatic nerve, especially the hamstrings and lower back, and signals the brain that movement is safe again. No pain, no sudden jerks, just slow reactivation. In traditional Japanese therapy, this movement is often paired with a breathing pattern. Inhale through the nose for 4 seconds, hold for 2, exhale for 6. Each exhale relaxes the nervous system. Each inhale sends oxygen deeper into tense tissue. Over time, this combination retrains your body's pain response, replacing tension with rhythm. Doctors at Osaka Pain Research Clinic describe it this way: sciatica pain is like a frozen river. The Shinkai stretch melts it, not by force, but by warmth and repetition. That's the secret. You don't fight the pain. You teach your body to trust movement again. If you can, try this variation. While sitting, lift your right leg so it's straight in front of you, toes pointed toward the ceiling. Now gently tilt your ankle forward and back, like saying yes with your foot. 5 slow repetitions, then switch legs. This is called nerve flossing, a small but powerful way to glide the sciatic nerve smoothly through its pathway. Japanese physiotherapists use it every morning for elderly patients with chronic nerve pain. As strange as it sounds, studies show this tiny motion can reduce nerve irritation more effectively than rest or painkillers. Because movement feeds blood flow, and blood flow feeds healing. Never push to the point of pain. If your back feels tight, place a cushion behind your lower spine for support. Practice this stretch twice a day, once after waking, once before bed. Morning restores circulation, evening calms inflammation, and if you can, do it near natural light or with a window open. Japanese therapists believe fresh air helps align your breathing rhythm, and there is actually science behind that. Higher oxygen intake improves nerve conductivity and overall energy levels. It's a small thing, a chair, your breath, a few quiet minutes, but this tiny habit has kept thousands of Japanese elders walking freely into their 80s and 90s. No surgery, no fear of moving, just discipline, patience, and respect for the body's own repair systems. Try it tonight. Sit tall, breathe deep, and let your body remember what gentle movement feels like. You don't have to rush healing, you just have to begin it. Did you know that many older adults in Japan treat leg pain and sciatica not with rest but with rhythm? In small towns along the coast, it's common to see elders performing gentle circular knee movements every morning before breakfast. They call it Hiza Kaiten, which means the rotation of the knee. To them, this isn't exercise. It's maintenance, like polishing the gears that keep the body moving smoothly. Western doctors used to recommend rest for sciatic or joint pain, but long periods of sitting make the problem worse. The Japanese discovered that micro-movement, even the smallest circular motion, stimulates blood flow and releases tension around the sciatic nerve. When Kyoto University tracked seniors practicing Hiza Kaiten daily, their leg circulation improved by 42%, and swelling around the hips decreased dramatically within 8 weeks. So how do you do it? Sit comfortably on a sturdy chair with your feet shoulder-width apart. Keep your back straight, and your hands resting lightly on your thighs. Now lift your right foot slightly so the heel hovers just above the floor. Begin tracing a slow, small circle with your knee, clockwise first. Imagine you're drawing a tiny circle in the air, using your knee as the pen. Keep your breath steady. Inhale as the knee moves forward. Exhale as it comes back around. After 5 gentle rotations, switch direction, counterclockwise, and repeat. Then change legs. The motion should feel smooth, never forced. If you hear small clicks or cracks, don't worry. That's your joint capsule releasing trapped air. In Japan, therapists often describe this sound as the knees sighing. It's the body's way of loosening stiffness built up overnight. Why does such a simple movement help so much? Because the knee acts like a pump for circulation between the lower body and the heart. When you rotate it, the surrounding muscles, calves, hamstrings, thighs, gently contract and release. That pressure pushes blood upward, reducing fluid retention and easing pressure on the sciatic nerve root. Even a few minutes of Hiza Kaiten doubles venous return, the amount of blood traveling back to your heart. It's nature's way of saying, keep moving and I'll keep healing. To increase the effect, Japanese physiotherapists pair the knee circles with toe grip training. After finishing your rotations, keep your heels down and lift your toes upward. Then press them into the floor as if trying to grab it. 5 slow repetitions. This simple action activates the arch muscles that support balance and posture. The combination of knee rotation and toe grip reconnects your entire leg chain, from the hip to the foot, restoring coordination that often fades with age. If your balance is strong enough, you can perform Hiza Kaiten standing. Place one hand on the back of a chair for support. Lift one knee slightly and rotate it slowly. 5 times clockwise, 5 times counterclockwise, then switch sides. Standing increases engagement of the hip stabilizers and strengthens the glutes, both critical for long-term sciatic relief. Avoid rushing the motion. Each circle should take about 4 seconds, as if time itself is slowing down with you. And always breathe through the movement. Japanese elders often recite a short phrase during the exercise. Kanketsu wa inochi. Circulation is life. It's their reminder that motion keeps vitality alive. If your knees feel weak or stiff, start small. Maybe 3 circles per direction, once in the morning and once before bed. You can even do it while sitting at your desk or watching TV. The point isn't effort, it's consistency. A little motion every day does more for nerve health than an hour of exercise once a week. Over time, Hiza Kaiten reduces inflammation, restores smooth movement to the hips and knees, and sends a calming signal up through the spine, the very path of the sciatic nerve. That's why in Japan they say, if you move the knees kindly, the back will thank you. Try it now. Sit tall, take a slow breath, and begin your gentle circles. Feel the warmth building behind your knees. That's circulation waking up. Do this for 1 minute twice a day, and within weeks you'll notice the difference. Lighter steps, warmer legs, less tension traveling down the back. You don't need machines, massages, or injections. Just patience, rhythm, and a few quiet circles. That's Hiza Kaiten, the art of moving pain away. In Japan, there's a quiet belief that the hips are the engine of longevity. They call this region Koshi, the bridge between upper strength and lower stability. When that bridge stiffens, the entire body begins to ache. Back pain, hip strain, even shooting sciatic discomfort. That's why older Japanese adults practice a simple motion every day called Koshi wave. a slow, rolling movement that re-educates the spine and reopens the pathways around the sciatic nerve. It looks effortless, but its effects ripple through the entire nervous system. Scientists at Tokyo Metropolitan University tracked seniors who performed Koshi wave twice a day for 90 days. The results stunned them. A 48% reduction in lower back stiffness, better gait stability, and fewer nighttime pain reports. One participant, aged 82, described it best. "It feels like oiling the hinges of my body." To begin, sit on the edge of a sturdy chair or stand with your hands resting lightly on your hips. Keep your feet hip-width apart, knees soft, spine straight. Take a slow breath in, and as you exhale, gently roll your pelvis forward, letting your lower back arch slightly. Inhale again and roll the pelvis backward, allowing your tailbone to tuck under and your spine to round just a little. That's one wave. The movement should feel fluid, like a slow tide washing in and out. Repeat this 8 to 10 times. Each repetition sends subtle motion into the deep hip joints and the small stabilizer muscles surrounding the sacrum, the area where the sciatic nerve passes. Don't think of it as exercise. Think of it as conversation with your spine. You're teaching your back to trust movement again, one gentle wave at a time. Japanese physiotherapists often pair this with a breathing mantra. Inhale, expand the spine. Exhale, release tension. Over time, this rhythmic pattern improves the brain's communication with the pelvic floor and reduces nerve irritation caused by prolonged sitting. If you prefer to stand, the same motion applies. Slightly bend your knees, place your palms on your lower abdomen, and roll the hips forward, then back, as if you were drawing a tiny circle with your tailbone. Keep your shoulders relaxed and your gaze soft. This standing version increases balance training and gently strengthens the gluteus medius, one of the key muscles protecting the sciatic nerve. Why does it work? Because most sciatic pain doesn't begin in the leg. It starts where the pelvis locks. The Koshi wave re-educates that joint, encouraging the sacrum to glide naturally with every breath. When that happens, pressure on the nerve root decreases and circulation floods back in. In MRI studies from Osaka Pain Center, patients who practiced daily pelvic mobility drills showed reduced inflammation markers in just 3 weeks. After your waves, stay still for a moment. Feel the warmth spreading through your hips. That is not imagination. It has improved blood flow and released tension around the piriformis muscle, a common culprit in sciatic compression. End with a deep breath, sitting or standing tall, letting your body memorize the feeling of space and support. If sitting too long triggers your pain, do 2 Koshi waves every hour. Tiny invisible motions, even while you hurry at your desk. Keep the joints awake and the nerves calm. Remember, motion doesn't have to be dramatic to be powerful. The smallest ripple can calm the biggest storm. In Japanese culture, they say, "Where the hips move freely, the years move gently." That's the essence of the Koshi wave. A 2-minute reminder that flexibility is youth and rhythm is relief. Try it now. Close your eyes, breathe, and let your hips draw their quiet circle. No rush, no strain, just motion flowing like water. With every wave, pain drifts a little further away.